Okay.
Hey, you guys, we are live. We are live in the chat. Who you waving at? Come on in. Come on in, you guys. I know this is a little different, so I'm not sure what platform you're watching from. So if you're watching from Kourtney and Eddie, then this is something different. If you're watching from Firestarter, this is nothing different. And if you're on Status Up, then it's definitely nothing different. So you guys, we wanted to bring on, this month is Mental Health Awareness Month. Mental Health Awareness. And so I wanted to bring on a licensed therapist to talk to us about our mental. So I'm trying to give people a few minutes to come on in so we can go ahead and get started. So let me remove this so you can see our faces. Hey, it looks weird on this. The lighting is off, y'all. The lighting is off.
The whole thing is off.
So we're gonna move back some. So come on in. I see people are already in the chat. You guys are chatting it up. I'm excited to bring on our licensed therapist on today, you guys. And you're welcome to post your comments down in the comment section because we want to hear from you. But we're going to talk about a plethora of things. I ain't say that right. A lot of things today. Let's see what I can say. A lot. We're going to talk about a lot of things on today, and we want to get this mind right, because if we don't have this mind right, nothing's going to be right.
That's
so
true.
You know, again, like I said, I know this is something new on different platforms, but hey, we want to talk about it. Come on, because we know that it is needed in our community. And y'all, please forgive me. Excuse me. I'm trying to get over this that I have. Hey, Red Gal. Hey, Miss V-Doll. People are already in the chat. You guys, I appreciate you guys for already being here or beating us here. So we're not going to further the time, and we're going to go ahead and get started. Oh, please forgive me. Hold on a second. My husband is here.
Yeah, I'm just taking up her slack because she still got the allergies going
on. So I do have this stuff going on. So at this time, I'm going to bring on our licensed therapist, Miss Valencia. I am. Hey, Tara girl, I appreciate you joining us. So we're going to bring her on, Miss Valencia, which is our licensed therapist. We appreciate you joining us on today. Like I said, we're streaming from 3 different platforms. And so wherever we can get this out, we want to get it out because we want our mental to be okay. You know, sometimes people act like they're okay and they may be on the outside, but up here, they're not. They're suffering. People are suffering from depression. People are trying to take their lives. People are suffering on so many different areas. And we wanted to bring on a licensed therapist to talk to the audience. You know, we're streaming. Sometimes we have people in Jamaica. We have people that are in the UK. We have people all over when we're on YouTube. So yeah, whoever is watching or will watch the replay, we want to hear from you. So we want, you know, people to get their mind right. So if you can just give us a little bit of your background, tell us your name and tell us what you do.
Well, good evening to everybody on this live. I want to say thank you. First of all, I'm very excited to be here. It's a privilege to be even considered. There's so many people out there that could do this, but Kourtney asked me to do it, and I was like, I'm more than happy to do it. So I rushed home to get in here. So again, my name is Valencia McCarroll Pruitt. Product of Birmingham, lived here all my life, and knew early on that this is something that I wanted to do even before I got out of high school. And so I worked for UAB for 27 years as a medical social worker. And I worked with high-risk maternity patients, counseling with them every single day, all different kinds of aspects of women's health issues. If they went through it in pregnancy, I did it. It could be substance abuse, grief, bereavement, just general pregnancy, psychiatric issues, all kinds of things. And I knew after I did that for 27 years and I went back to graduate school, it was just something more that I felt like God had me, that he wanted me to do. And so I did that, and I decided that I wanted to look into private practice and found a friend that was also interested in private practice. And so as a result of going back to graduate school, I ended up working with eating disorders. And so that's what I'm currently doing, is working with women who have eating disorders. But in my private practice, which is Willow Grace Wellness, we launched that in 2019. I had a slight illness in 2019 that kind of threw us off course. And then we launched full throttle in 2020 with our private practice. And so my thing is, God gave us a vision. He wanted it to be ministry for us in our practice, not just run-of-the-mill counseling services. He wanted us to be a ministry, especially to African Americans. So we started in 2020 and didn't have any money, didn't have any provisions. We didn't have anything. And God said, well, if you believe in what you're doing, you got to do something. I'm like, but what am I supposed to do, God? What am I supposed to do? And I said, well, maybe I can sell t-shirts, awareness t-shirts, because getting the stigma out of the Black community was really important to me. So I started selling t-shirts about mental health awareness, and we sold over 500. And little did I know that the money that we generated from selling those shirts was going to be the money that God put in place for us to open our office. Wow. And maybe 2 months, 3 months later, we were able to find a location. We went from one office to 2 suites in less than a month, because God provided that for us and opened the doors for Willow Grace Wellness. Then the pandemic hit.
Wow.
So we didn't get to practice for a while, but we actually launched the office in August of 2020. And since August of 2020, we have 2 contracts working with us, and we have about 25 clients right now. So,
oh, please forgive me. I'm having to put myself on mute so I don't cough in everybody's. So, actually, we purchased two of the shirts ourselves, and I wear mine all the time. So, yeah.
Thank you.
That's actually wow. Look at what God has done. That is amazing. So you went from that into having your own practice, even though you're still working full time, you have a side practice. I mean, that's amazing. Yeah. And that you have a heart to want to help people. You know what I'm saying? Yeah. That's the difference. You have people that are actually working and they don't have a heart for people.
Right. Yes.
And that's a difference.
I think it is a difference. And I mean, to work with people for 27 years lets you know that that's really where my heart is with helping people. And I guess when I did that for UAB, it was like, I just want to do more. It's something more. I don't want to just see people periodically. I want to connect with them on a deeper level. I wanted to be the person that I was sending other people to. Because at UAB, I'm seeing you and I'm talking to you and I'm counseling you, but you weren't going to stay with me because you were pregnant. And so I would have to send you on to somebody else. And I'm like, I don't want to send people to somebody else. I want to be the person that they sending people to. Right. And so I put, God helped me to get the licensure that I needed to be able to be that person. And then birthed Willow Grace Wellness in my spirit, as well as my partner, Tangi Macon, to be a light to the community. So when we founded Willow Grace Wellness, our mission statement is to educate, eliminate, and eradicate the stigma, which is what the t-shirt was. And we felt like if we can educate the community about mental health and its importance, we can eliminate the stigma and the hang-ups that we have in our community about seeking the services, which hopefully can eradicate it all together. And we're not the only people out here doing that. There are people all over the state, all over the country doing it. There are celebrities doing it. I know if y'all ever seen Taraji talk about mental health, and she has her own foundation that she started after Empire. After she came up with Empire, and she launched a mental health service. So there are many people launching platforms to support mental health services and eradicating the stigma, because for the African American community, I think that's one of the biggest things that are affecting us, is that we're ashamed to say that we need help. Yeah. And how do we get past that? I mean, we really, really got to get the word out that it's okay sometimes not to be okay.
Yeah. Right. Yeah. And I think that goes back to being a strong Black woman or a strong Black man, to feeling like you don't have weaknesses and vulnerability, and, when some men were raised, you're not supposed to cry, and we've seen strong Black women, like, some people may have never seen their mom break down and cry, or, have those, breakdowns. So if you looking at that, then you think, well, I'm not supposed to cry. I'm not supposed to have a breakdown. I'm not supposed to, not be okay. So yeah, I think that is it has pretty much damaged, our community to feel like we're not supposed to be, okay at times. We're supposed to be okay at all the time.
Right. It's definitely a cultural curse for the African American community, even dating all the way back to slavery. I mean, you think about if you watch Roots or whatever, and you got somebody lashing you on your back, and you trying to tough it up, you're not supposed to cry, you're not supposed to show weakness. And so we've actually, it's kind of bred into our men that that's a mentality that we're supposed to have. And just like you said, we teach our boys, stop crying, don't be no girl, you ain't no punk. And we say all these things to our boys, and then they don't show any kind of emotion. Then all of these things build up inside of them. They don't express it. They don't connect with their emotions. And then later you're a grown woman and you want to get married and you want them to be sensitive. Well, you just told them not to cry half your life. Now you're asking them to be sensitive. What you want? But what we don't realize how that impacts our lives, and how I think most of the people that I see have a disconnect with their emotions. They don't even know how to connect with emotions outside of anger. A lot of people that I talk to, they know how to be angry. Right. And you get a bad rap anyway for being, angry Black women or Black men being angry. But technically, if you look at research, Black men a lot of times aren't necessarily angry. A lot of times it's depression. In Black men, for whatever reason, anger is more prevalent in depression. That's how it manifests itself, and that's how it shows up. It's really depression a lot of times, but it shows up as anger. Whereas in our counterparts, it doesn't show up that way. It shows up more like, look, they're lethargic and not wanting to connect and wanting to be, do things. But it doesn't show up like that in our males. So when you think about the crime rates and the intensity of what's going on in our streets, it's not necessarily angry men. It's depression from other issues, probably a lot of times.
Wow, that's something new right there. I did not know that. I just thought, just anger built up from the way society has been putting us down. But to hear it saying, the reason why we lash out is because of depression, I learned something new just then. So,
well, I think it can be a combination of all of the above, but we can't ignore the underlying factor that depression is a part of it, because you've got systemic racism, you've got financial hardships, you've got all these things, you got how you've been brought up and you've been raised, lack of access to your relatives, your dad, your mom may always be working, and so you're kind of raising yourself, poverty, all these things come together that create the perfect storm when it comes to mental health, especially in the Black community. And because we have so many disparities in our community, it just puts us at a higher risk for mental health challenges, and we don't acknowledge that. One of the things that's passionate to me and to Tangi is that there's a book that I read that's called The Spiritual Bypass. And the spiritual bypass talks a lot about the fact that a lot of times most African Americans, for the most part, are faith-based people. And we are Christians a lot of times, and we go to church, and we are taught that that's all you need to do. You go to church, you lay your problems on the altar, you give it to Jesus, and it will all be better in the by and by, and you don't have to worry about it. But the spiritual bypass is not always the answer. And I'm a Christian as well, and I do believe in the power of prayer. But sometimes there are situations that we face in our life that you really need to be delivered by God from your situation, but you also need to go talk to somebody to process the trauma that you went through in the process. And that's the part that we don't connect with. And the Bible even tells us that in the multitude of counselors, with an S, there's safety. Yes. And so you can utilize prayer in your relationship with God, but he can also direct you to a therapist that can benefit you and help you sort out some of the things that you're going through. Just like it's no different than going to a doctor if you have cancer, or going to a dentist to get or orthodontist to get your tooth extracted, or periodontist, or you got diabetes or the sugar as we call it. You're gonna sleep about all that stuff. You're gonna sleep out your sugar, but you've been suffering with depression for 8 months and you want to hide it under a rock. Why you want to do that when you can go find some help for it and also still be delivered?
Right. Wow. So, did you have a question?
No, go ahead. I got a question later on. I want to ask.
I do have a question, but let me some of these comments people are let me just kind of put them up here real quick. So somebody said congratulations when you opened your own and somebody wants to know Miss Arlene, is it Arlene? She wants to know, can she get a shirt? Where can she get a shirt?
We still have a few here. If you message me at Valencia at willowgracewellness.com.
I will put your information down here because she may not, so I'll definitely put it in here.
We still got a few in the cut.
Okay, in the cut.
West too.
So she's tuning in from Tampa with her aunt, and so yeah, thanks for your contribution to mental health. Let's see. They say, "Hey, Kourtney." She says she's glad. Hey, Kourtney, Eddie. She's glad that she's able to make the live tonight. So yeah, I just wanted to go in and just put these questions up here before we go on. Yes, I agree that Black people, male and female, suffer from depression. I do want to talk a little bit about depression. Excuse me.
Resilience and being strong is killing us. And being strong, I guess you said being strong.
Yeah.
Okay.
So so let's talk about depression. So many people are suffering from depression. So many people need help when it comes to depression. You know, they're scared to say they're depressed. Hold on just a second, y'all.
She's out in chat, y'all. She'll be right back.
So you guys just hold on just a second. She'll be back. Somehow her internet could have went down. She was having some internet issues before, and y'all forgive me. I am trying to get over this, so I am coughing.
It's allergies. Her signs of drinking. Okay, here we go. We back.
She's back.
Technology.
Yep, there it is.
Word out.
That's okay. It happens.
Yeah.
So we're going to talk about depression. So, so many people are suffering from it. What can they do?
You know, when we look at depression, for me, it's always been important. Like when doctors used to send people to me, and she's got depression. You need to talk to her. And I don't have a problem talking with people about depression, but I think it's very important to separate situational depression from clinical depression. So a lot of times you really need to do initial assessment with people and figure out what's the source of what they're struggling with. When you think about situational depression, something has occurred, some adverse circumstances happen that they're struggling with in that moment. It could be death. It could be a loss of a job. It could be a physical illness or something like that, which is situational. So that tells you that a lot of times that person that may be struggling may need some support, but it's not long-term support, because if that situation has a resolution in sight, then they will go on and be fine. But when you start thinking about clinical depression, it's not necessarily connected to an event or a circumstance. It's because I just ain't right. You know, I'm not feeling good. I don't feel like myself. I don't want to get up. I don't want to go nowhere. I don't want to eat, or I can't sleep, or I sleep too much. Just all of those things. And I cannot shake this. When that happens, then you may need to talk to your healthcare provider, because medication may be necessary to help you balance those chemical imbalances in the brain that are causing you to feel this level of depression that you cannot shake. And sometimes we couple that with psychotherapy just to make sure that people are able to sustain themselves throughout the course. Can it be resolved? Absolutely, it can, but it may take a whole lot longer just because of the persistence and the level of depression that person may be experiencing. So I definitely would tell people, don't be afraid of medication. Again, it's no different than taking medicine for something else, but it's the stigma on mental health that causes us to have shame, to have guilt, to feel like we ain't praying hard enough, or we got a demon, or all of the different things that people come up with as reasons why they don't want to seek out mental health. And if you need medication to regulate yourself, take the medication, and don't take it until you feel better and go, wow, I'm great. I took it for a month. I'm good. I don't need it no more.
Right.
You might need it for a lifetime, just depending on what your diagnosis is. But you don't be so quick to dismiss the modalities of your healing, because they can manifest themselves in so many different ways.
Yeah. Go ahead.
I'll ask you a question, Doc.
Ain't no doctor, don't go there.
Okay, yeah, okay. Anxiety, is that just, does that come from depression, or is that like a different animal on its own?
They can be co-occurring. It's not common for them to be co-occurring, which means you can have both at the same time. A lot of my clients that I currently see right now have both. But anxiety can stand all on its own and just be its own thing, which is, again, persistent worry. We all have certain levels of anxiety. I mean, that's just common. We're human, and things happen in life that make us anxious. But anything that's persistent and it's disrupting your daily life, that's when you know it's a problem. So if your anxiety is preventing you from doing things, it's keeping you in the house, especially with COVID. A lot of people got anxiety when COVID hit. They didn't want to go nowhere. I don't even look at me without your mask. They watching the mask and watching TV with the mask on.
Yeah.
That's real anxiety that you can't function. Again, there are medications that can be given to support you. And like with me, we don't diagnose. Counselors and therapists don't provide medication. That's why we work with psychiatrists who are able to prescribe meds. They just send you back to us for the counseling. But the medication is a necessary component a lot of times for people to regulate themselves.
Okay, yeah, cause I think sometimes when I get in a big crowd, I get kind of anxious, and I don't know if that's some kind of form of anxiety or not.
Yeah, you're talking about social anxiety.
Right.
And a lot of people have social anxiety where they don't like being in big crowds, or it makes them really uncomfortable. They'll avoid it like the plague, just don't want to do it. So in therapy, that would be something we would help you work on. We find out the level of anxiety that you have when you are in crowded situations. What happens to you? Do your hands sweat? Do you get nervous? You got butterflies, your heart beating fast, you can't talk, you don't want to give eye contact to people, all the different things that kind of happen with social anxiety. Then we work with you on those things. And then there are different modalities, certain things kind of like exposure therapy. We start to work with you, and we take you into smaller settings, and we gradually start you out. Well, let's go just get some ice cream, and it may be 5 people in here. And then if you do that successfully, then we'll challenge you to do something else. Well, now let's go here where it may be 25 people. Until we can get you to the point where you turned up at a concert.
All right, so we have some questions. Let's see. Besides talking to someone, what are some other things we can do to keep our mental in check?
Besides talking to a therapist, I'm assuming that's what they mean.
Yes.
I would tell anybody, you don't have to see a therapist to learn to use coping skills. You can Google coping skills to help you if you have levels of anxiety, and find things that work for you that can be distraction tools that can help you learn to.
Not even with anxiety. I don't think she was talking about anxiety, but
mental health period.
Yeah, just mental health period. So if she doesn't want to go, talk to someone, what would be the other option?
I'm still using the tools, even if you don't want to go. And it just really depends on the severity of what you're struggling with. I mean, you can go to church and you can meet up with people and friends and use their support, use people in your life as your support system. But I think it really just depends on the magnitude of what you're dealing with. If it's stress or anxiety or anything else, then you may want to use meditation. You know, you want to do yoga. You can go for a walk. Being outside in nature helps your mental health. Just getting some vitamin D and excusing yourself from certain situations. Learning how to set boundaries with the people in your life that may be toxic.
Right.
You can do that on your own, but a lot of people don't do it. But if you got toxic people in your life that's challenging your mental health, in such a way, then you may need to set some boundaries with people in your life. Don't be afraid to change. Don't be afraid to change your job. Don't, I've had people that have really difficult jobs and it's causing them, mental health concerns that are over the top and they don't want to leave because they like the money. Well, is money worth your mental health?
Yeah.
Is it? Is it? I don't think so. Because if you have a nervous breakdown, then you can't spend the money, right?
That's right. That's
or you
right.
didn't give it back to the doctor in the first place.
All right.
Yeah. So I know from me being transparent, I used to suffer with seasonal depression. So and in that I would feel like I would need like I was missing something, like you said, clinical. It wasn't that nothing was going on. It's just like I just felt it, felt very heavy. So I just kind of started doing some research recently, and I found out that I feel better when I take vitamin D, when I've taken omega 3. So I put the vitamins in myself, and even the fact that my thyroids, I've done all that research and put the stuff in myself, and I have no problems with it as long as I continue taking those vitamins and stuff like that.
Right.
So a lot of it is what your body's lacking.
Right. A lot of it can be that. So using supplements definitely can help. That's something you can do with your primary provider, finding out, getting all the tests done to find out what your levels are in different areas. Even things like with women, like hormonal things, like not having enough estrogen, not having enough testosterone in your body. Some women don't even know we got testosterone.
Right.
It causes mood swings, it causes depression, it causes anxiety, it causes all these things. You can go get a pellet, you can have testosterone cream, you can get your levels back up, which help regulate your mood. But you got to go somewhere generally and find out the source of what you're struggling with. So like with seasonal depression, it can be generated just because, or it can be based on a situation that may have occurred around that time of year. I can remember years ago, I too suffered from seasonal depression, but mine was based on an event that happened to me like in October.
Right.
After that event happened to me in October, for the next probably 5 or 6 years, every time Thanksgiving came, I was in a funk from like till January. It's like I just wanted to rush through all the holidays. I didn't want to do none of the holidays. And it was like when January 2nd came, I was a brand new me. I was back to myself. And that happened for years, but it was based on something that had happened to me back years ago in October. And it took a while for me to work through that where it was no longer an issue for me.
So with that happening, people need to seek counseling and be able to work through that if that's what it is. They need to, of course, pay attention to what's going on. If you're getting depressed around a certain time, if it's not, I guess seasonal. I mean, it may be seasonal, but not, maybe
due to the season.
Right. So you need to pay attention to that and talk to someone.
I would definitely say pay attention to yourself, but also listen to the people that are around you. The people that are closest to you, they know you a lot of times just as well as you know yourself sometimes. And if they're alluding to the fact that you don't seem like yourself or you seem cranky or snappy, don't get angry with them because they're saying that. Really check in with yourself and see, am I really doing this? Is this really going on? Especially even if it's your children. Sometimes we don't want to listen to our kids, but they got insight. They in the house with us. They know when we acting crazy. So we need to check on that and start with your mental health. Start with a primary physician first. and just go to them and say, I'm not feeling like myself. These are the things that I'm experiencing. What can I do? What do I need to do? If your primary physician does not help you, then go see a specialist, especially for women. Go see someone that does hormone therapy. Check that out, because sometimes your regular doctor not going to look at all those levels for you, and see if it's that, and figure out exactly kind of what's going on. And if you get to the point where your healthcare provider feels like, this may be clinical depression, or they evaluate you and say, you've got a lot of things going on, a therapist may be beneficial to you. Just don't blow it off as, I'm just going to go to church. I'm going to just add in some extra meeting, and I'm going to do this. Not that it won't work. It can work, but you also, again, still need something else in the mix.
Right.
It's not taboo to do it.
Right.
Exactly.
And that's my point. I'm not preaching to people trying to make them get mental health services to line my pockets. It's not about me lining my pockets because that's what I do. It's about having that awareness within yourself to know that sometimes I may need additional support and help in the skills that were taught to help you facilitate your needs at that time.
Okay. You want to read that one?
All right. Somebody on Facebook said, "What if you are the breadwinner of your family and you have a very stressful job? What are the ways to unplug and combat depression?"
I would definitely say, if you're the breadwinner for your family and you just got a stressful job, and you got to maintain that job, you got to stay on that job.
Yeah.
Then you really need to check in with yourself and find ways to support yourself. If you know it's the job and it's not clinical depression and it's not persistent depression for no reason at all, and it's job related, then you got to find ways to unplug and build yourself up when you're away from work. You got to leave work at work.
Right.
You've got to find time to relax your mind, turn your brain off, and do things with your family, or like I say, go outside in nature. Find something that can help you to find some way to release the stress that you're experiencing at work.
Right.
People used to say pressure busts a pipe.
That's right.
And it does. So you've got to have an outlet of some sort. And if you find that once you've done as many, have a hobby, find a hobby. If you, whatever you like to do, if you don't have one, create one. Take up photography, go listen to music. Just don't do negative coping skills when you find yourself having depression, because a lot of times that's what most people will gravitate to. We're going to gravitate to the alcohol to try to make ourselves feel better, when alcohol is a depressant. So it makes us feel better for a second, but actually it makes and creates things to be worse because it's a depressant.
Right.
We'll gravitate to illegal drugs. We'll gravitate to all of the negative things that we think make us feel better, when in actuality they just don't.
Okay.
And get adequate sleep too. If you're working hard, a lot of times people that work too hard and they stressed out, they're not getting adequate rest. Sleep is essential for your mental health. So if you're getting 4 hours of sleep, you cranky, you got a bad mood, nobody is benefiting from this. You need quality sleep, 6 to 8 hours of sleep. So make sure you're getting quality sleep as well.
Okay, day-to-day school or social work. Can you talk about the dangers of abruptly stopping certain medications? I don't know that
a lot of different meds. You definitely don't want to abruptly stop meds, because you can have adverse side effects from stopping any, some of the medications that you get, especially when you're struggling with things like bipolar disorder, schizophrenia, schizoaffective. Those are your more profound mental health diagnoses that require heavy duty medications. Stopping them abruptly can have adverse side effects, so you definitely don't want to do that. A lot of times, if you are in a position to stop taking drugs, and it would take a physician to give you more information on that, you want to wean off of them if you don't need them any longer. But most times, a lot of people with severe mental illnesses are on those drugs long term. But definitely abrupt stopping any medication is going to give you adverse side effects. Again, you find a lot of people that are taking meds, again, they're doing fine, they feel better, they feel like themselves, and then they stop and give them 3 weeks. They're going to have this crash and burn, and now you're back in the emergency room or something of that nature because you're having, side effects from abruptly stopping medication.
Okay, it was some a part 2 to that. I'm sorry, I want to make sure I read all of her. And she said, and how it's important to stay on top of the doctors to educate us on the dangers of it.
Yeah, it's important for all of us to be proactive in our healthcare. I mean, a lot of times, one of the things that bothered me when I was at UAB was the fact that people they just took the doctor at their word a lot of times, even though it's you should be able to trust your doctor, right. But at the same respect, you have an accountability to yourself to know what's going on with you and check in and ask questions. Be empowered when you're seeing a healthcare provider. Don't let them misdiagnose you. A lot of times that can also happen in the African American community. We get labeled with diagnoses that we have no business being connected to, because of the provider. So a second opinion is not out of the question, but also just checking in and being an active part of your healthcare is essential.
You want to read that?
No, you read that.
Valerie said, ask Valencia to share the books that she's using in the small groups in progress.
Wow, that's Valerie Jones. That's my church member. Bless her heart. Hey, Val. I mean, I guess because I am passionate about people, I do a small group at church. And to me, God told me to do a small group at church. And he wanted me to help use that as an avenue to start normalizing talking about mental health issues. So when I started doing small group classes, I always made sure that the books that God led me to were related to some mental health in some capacity. So we've done groups about anger and what it's like to deal with anger in everyday walks of life. We've done healing from hurt emotions. And the current book that we're doing a small group is, what is it about? Toxic soul ties, breaking toxic relationships, breaking toxic soul ties. And a lot of times when people hear toxic soul ties, they think just about relationship issues, and it's bigger than relationship issues. Toxic soul ties can be with any relationship that you're connected to. It could be with your mom, your sister, your boss, your pastor. It could be anybody. So we try to put things in a box and make it seem like, I'm not dealing with toxic relationships. I'm fine in my relationship. It could be with anybody. Right. And so teaching you to not be a victim in these relationships. You have some accountability to yourself as well, to not make yourself vulnerable to toxic relationships, and also looking at areas in your life that make you more vulnerable and susceptible to toxic relationships, because a lot of times people repeat these patterns over and over and over again. Well, until you change what's happening within you, you're going to continue to repeat these cycles in your life.
And so that goes into, because if people don't know, you are one of the people that is in Status Up that comments a lot, and you are the funny one that comments. You have a lot of jokes when you comment. Oh. You didn't know she was in Status Up. Yeah, I know she was. So being in, of course, for those that don't know, Status Up is a Facebook group that I created that is just about your status, whether you're married, single, divorced, widow, whatever. So we kind of talk about relationship, funny stuff, inspirational stuff. So when it comes to, before we go to this next question, when it comes to relationship, some people are having a hard time finding a mate. Could it be because they need some therapy?
I mean, it could be. I mean, we really have to be honest and forthcoming with ourselves and be transparent and look at ourselves in the mirror first and figure out what may be happening with us or what may have happened in our past that is still affecting us in the present. If you had an adverse situation or a traumatic situation to happen in a relationship, especially if it's happened more than one time, then you may be having trust issues. It may be causing problems in every relationship that you come up with. If there's mental instability in your genetic pool, a lot of times there may be issues where, you know, there may have been some mental health issues with somebody else in your family, and it skipped the generation, but now it hits you. And you don't talk about those things in the relationships that you're in with people. So they just don't understand you. So now you can't connect. You can't be on the same page because you're trying to hide versus trusting that person and being vulnerable with that person to say, hey, look, this is something that I struggle with. Maybe they can understand you and they're willing to understand you better if you disclose that information. But a lot of times we don't address some of the things that we've had in prior relationships. They may still be affecting us. We carry that baggage on and on into the next relationship and the next relationship instead of dealing with it, processing it, figuring out what I need to do different, how am I contributing to this? Right. Because a lot of times, even some of the people that I see now, they don't even realize how they contribute to the dysfunction in their relationship. And I'm like, sis, you got a part. It ain't just him. Did you hear what you just said? So in therapy, I may role play with you and say, okay, I want you to sit over there and listen to what you just said, because I'm finna say it back to you. And this is what you said to your husband. Do you understand why he feel like he feel? Because of what you said, she like, oh, well, I guess, you know, that, because I'm a realist when I do therapy. It's like, when I hear you say something that I know is causing problems in a relationship, I'm here to support you because you're my client, but I'm also obligated to let you know what you two are doing wrong in this relationship. You can't continue to put it off on the other person.
Right. So you do marriage counseling or couples counseling as well?
We can. At this point right now, I have seen a lot of individuals. I have not done any couples counseling at this point, but we're very much open to it. My partner has, and mainly because I had their child and they needed counseling. So my partner saw the couple. So I have not engaged in couples counseling as of yet, but it's not off the table.
Okay. So do you recommend that somebody, after they get out of a long-term relationship or a divorce, that they see a therapist?
Not necessarily. You just need to spend some time with yourself.
Okay.
And stop jumping back into another relationship. Some people have a problem being alone. You need to learn how to like you by yourself and figure out what you need and what's going on with you before you unpack into another relationship. I don't actually, unless it was a traumatic experience like abuse or somebody was on drugs, or if you experience some kind of trauma with violence or something, I don't think it's always necessary that you need to see a therapist. But if you have a pattern of behavior and it's happened multiple times in multiple relationships and it keeps ending the same way every time, then you may want to kind of process that with somebody that can help you unpack what you may be dealing with.
Okay. Perfectly said.
All right. Question. How do older women deal with getting older? Are there steps that a woman can take on her own to help her with this type of depression?
On your own, I'm sure that there are things that you can do. I mean, I feel like I'm getting old. I'm 53. So maybe I fall into that category. And a lot of times I think for older women, as I'm going to say, and seasoned women, we get into this depressive slump as if we don't feel needed or validated anymore. You know, society kind of generates and glorifies being young in our society, and we start to feel useless. And some women do at a certain age, but I'm all about recreating yourself, creating opportunities for yourself to make you feel more empowered, to help you feel good about yourself. Again, still seeing your healthcare provider to find out if anything are chemically imbalanced in your life, to check on that. But also re-engaging and connecting with life and finding new life, finding new activities, finding new hobbies, finding ways to connect with like-minded people to grow. Don't fall into this slump of uselessness, whereas I don't feel valued or I don't have any further worth. I think women should always recreate themselves and find ways to support themselves.
Okay. Let me ask this question before we move to the next one. Do you recommend that people do, if nothing is wrong, that they have a therapist on hand to talk to maybe once a year, once every 6 months, just to kind of unload? Or if it's nothing wrong, then they don't need a therapist?
I think it can be helpful to have somebody in your pocket that you can go to when you're just struggling with day-to-day life issues. It doesn't have to mean that you have a psychiatric diagnosis. It could be just life stress. It could be daily stress. Somebody that's not going to be judgmental. Somebody that's not going to try to tell you what you should do and shouldn't do. A lot of times that's what happens when we go to our family or friends, or they're already biased in the situation, or they feel like, well, girl, I wouldn't take that, or you don't have to do that, or they just want to tell you what to do, and that's not what you want from them. You really just want somebody to listen. And some people will say, I'm not paying somebody money to just hear me talk. Well, it's really helping you process making decisions, making changes in your life, identifying things that may be challenging to you that you can't even recognize because you're in the middle of the situation. So definitely, I don't think it's wrong. It doesn't, once you start, it don't mean you got to be there forever. You may go for 3 times and get some support and some resolution, and you may not go back for 6 months or a year. But when that person, at least establish a relationship with them so that they know you, and when you need them, they're there. I have a therapist. I would tell you, if you got a therapist that don't have a therapist,
okay,
it's like every pastor need a pastor.
Right.
Every therapist needs somebody that they can connect to, even when the weight of talking to other people about their issues all the time gets too heavy. You got somebody that you can go to and like, man, this is a lot. I got so many clients and this is getting really heavy. I need to process my stuff with somebody. And there's nothing wrong with that.
Wow.
Oh, you don't do that? Let me get my glasses right. If someone is reluctant with counseling but comes in because they need it, how do you break the ice to get them to talk?
If they actually show up for counseling and they need it, but they won't talk.
Yeah.
It's their time, and I'm there for them. I'm not about pulling teeth in therapy sessions. I need you to want to be invested in your healing, in your deliverance when you come to counseling services. I talk to you. I ask you questions. I may probe a little bit, but I need to know why you're here. What brought you here? A lot of times you find reluctance and resistance, like in situations when it's court ordered. And I feel like they really need to be there. I'm just coming because they told me I had to come. So you get a lot of reluctance when it comes to that. But you can use modalities like motivational interviewing or things like that to help people and try to figure out their reasons for change or their level of change. Nobody's going to want to change or benefit from therapy if they don't really want to be there. So they're wasting your time and the therapist's time if they don't want to do the work. But you can assess their level of change and maybe try to motivate them through questioning and asking different things of them to see what the likelihood of them wanting to change is. And it may not happen in the first session. It may happen in the third or the fourth session. You just kind of really have to be patient with people and find out where they are and where they want to go moving forward.
Okay. All right. What can that person do to prepare themselves for counseling sessions?
How can you prepare? Yeah. Be open-minded. Don't be closed-minded about what's going to happen. Most people look at television and feel like they already know what's going to happen. They see this old white man with a notepad with glasses on, and you laying on the sofa telling all your business and all your family secrets. And it's not like that. I mean, obviously, I ain't no old white man with a clipboard. And I try to be very personable. Part of therapy is establishing trust and rapport with the person that you're seeing. And once you've done that, then you feel more comfortable opening up. Most times people that I've seen, they're really they may be shy or hesitant about coming in. They don't know what to expect. But once they meet me and they talk to me, and I may ask them when they come in, what's your anxiety level about being here? From 1 to 10, I love scales, motivational interviewing, we use scales. 1 to 10, what's your level of anxiety about being here? If 10 mean really anxious about being here, most times they'll say a 10 or a 9. But by the time that 55 minutes is up and we've kind of engaged in conversation and I've asked them about themselves and just talked to them in a regular form of communication, and before they leave, what's your level of anxiety? They'll say a 2 or a 3, or when I'm schedule my next appointment, and so it is very therapeutic to have someone there that's willing to listen to you and connect with you. We're real average people. You got some people that's over the top clinical, and that's just how I orient. I'm about being real talk, real people every day, especially when you're trying to get African Americans to engage therapy, because a lot of the time cultural competency is an issue when you have a provider that doesn't look like you and they don't understand the lived in Black experience. So now you telling me, oh, she throwing shade, and they don't know what shade means. Things. So now you spend half of your session trying to explain Black dialect and that kind of stuff. So it's kind of helpful to have someone that's culturally competent already. Not that it has to be a Black person, but if it is a white provider or some other nationality, you want to ask them questions about how many successful clients do you still maintain in your practice that are African American, not seeing them one time and they didn't come back, but repeatedly coming back to let you know their level of competency seeing an African American client.
Well, let me share with you. I got therapy maybe a couple of years ago, and it basically because I feel like, I don't know, not that I needed it, but I wanted to have that experience, so to speak, and just to see if I needed it. I don't know if that makes sense. But and so as I was talking to her, she was okay. I mean, we talked about my childhood, but one thing that I did do many years ago, I got, and I know that people need to see therapy, but for me, let me say this was for me. I took time and really got along with God, me and him, and basically broke down some things in my childhood that was affecting me today. And that was like a 3-month journey, and I pretty much got delivered, but then got a revelation over why I act the way I act, and it was because of some things in my childhood. So it was basically a therapy session between me and God. Now, again, I don't recommend people do that if you don't feel led by God to do it. Definitely get therapy and sit down. But as I was talking to her and just expressing to her, my journey for those 3 months, and she was like, well, it sounded like you did a lot of therapy between you and God, on your own. So it was kind of like, I don't know. I didn't go to her but maybe 3 times. I just didn't feel like she was doing me no good, But so I know we have to understand that sometimes we can be over religious and over churchy, as we could say, and just thinking God is going to fix it. But like you said before, there were physicians in the Bible. Luke was a physician. So, God put doctors and physicians and therapists here on earth for a reason, for us to talk to them. So, it may not be the case where everybody could be so spiritual or whatever the case may be, where it's just going to be you and God alone. You may not know exactly what to do. So I know you touched on that, but can you just touch on that part again for those that are just coming on, as far as dividing the spiritual versus the natural, understanding that too?
I just think there's a real fear, especially in the African American community, about seeking out mental health services, especially if you're a person of faith. We've been culturally trained and taught that all of our needs need to be met by going to the altar and seeking out God for all of our needs. He's going to supply all of our needs. He's going to deliver us from all iniquities. He's going to do all these things, and he will do those things for us. Again, he will help us when we have been in traumatic situations. He will deliver us out of adverse situations. But sometimes it is important to connect with a therapist or a counselor who's been trained in modalities to help you identify where you may be stuck. And that's the part we don't always understand or comprehend, the fact that because I got raped when I was 17, this is now affecting how I date men at 32. We don't always understand that. We don't understand sometimes how to heal that. So I call it, in the book that I read calls it, a spiritual bypass, because we try to escape everything through religion. While it is a modality and it's definitely a support that we need, and we definitely want to seek God in prayer. And I'm with Kourtney. There are those of us, or there are those who can seek out God in their secret place, in their quiet time, and lay down prostrate before the Lord and just get the revelation that you need to say, this is where you're struggling. I'm going to show it to you, and this is how you need to fix that. And I'm going to divinely give you that information, and you don't need anything else. But for those of us who are mediocre and are not going to spend that quality time in our prayer closet with God, then you may need somebody in the natural to walk with you, because you may not be that diligent in your prayer time and your dedication to God to seek out that information from him. I'm not saying he can't do it. I don't want people to get it twisted that he can't. But I also urge and admonish pastors to normalize getting mental health services, counseling when necessary. Sometimes we go to the pastor, and if you are bipolar, he don't know what to do with that. He's been trained in theology, and he don't really know how to do cognitive behavioral therapy to help you with OCD or bipolar disorder or things of that nature. He can pray for you, absolutely. Get all the prayer you can get, put oil on your head. I'm all for all of that. But at the end of the day, if you're dealing with something that is a mental health disorder, you're going to need some other modalities on board. You're going to need some medication on board. In addition to God, I got a t-shirt that said God and therapy. Mm-hmm. You can do both. It is not taboo.
Right.
Oh, it's totally okay. He condones it. Yes. I promise you he do.
Now, if your pastor haven't had therapy, can they give you therapy? You know what I'm saying? How can they counsel you if they've never had therapy? You know?
Right. And a lot of pastors are comfortable with marriage counseling, and I'm good with that, because you've got scripture-based information to support you with that. But there were demons in the Bible that people got possessed with, and they cast out demons and things like that in the Bible. But now we do have medication, and we have a greater understanding of mental health diagnoses that are labeled and identified in the DSM-5, where we can actually be treated for these different I can't think, my brain turning off. For these different issues that we may be struggling with. And it's okay. Sometimes you do need medication for different things, and it's fine. It's no different than taking your blood pressure pill every day. But it's the stigma. Again, it's the stigma in our community that tells people, and we say things, and I even said crazy tonight, and I shouldn't have said that, so I apologize. But it's words like that get us all in trouble when we say crazy or off their rocker, or she a little cuckoo, or all the terminologies that we say to our friends that make people feel uncomfortable. And I've even heard pastors say them from the pulpit sometimes. You don't know who in your congregation may be suffering from a mental illness. So I always discourage it. And these are conversations that I've had with my own pastor, who is a strong proponent of mental health services and seeking out support outside of church. And I even went to him. I said, what do you do when somebody presents to you with something that you didn't learn in theology school? Do you refer them to somebody else? Helping them find those resources in the community to connect them to the services that they need. So getting both is definitely necessary sometimes.
Yeah, I'm gonna ask you this question. Speaking of the stigma, now, how do me as a man approach another man? Because you know how we are. We got this pride, this stigma, whatnot. How can I convince somebody that's reluctant to go to therapy? How can I try to kind of break that ice to get him pushed to therapy? What tools do I need?
Yeah, I mean, if you've been before, that's transparency is probably one of the best things that people can do in normalizing the process. If you've been or you know somebody who's been, acknowledge that as a thing. It's man, I know you're struggling. It sounds like you're struggling with a lot. That's heavy. Have you thought about talking to somebody about that? And if they kind of dismiss it, try your best to normalize seeking support. Don't institute shame, anything like that. I think those are the biggest barriers that keep men and women from seeking support. It's all about normalizing it. I know somebody. Can I go with you?
Right.
Those are the things. I just want you to get help. I want to see you be your best self. I don't want you to just keep singing living my best life.
Right.
And it ain't your best life. I really want you to live your best life. And if it means me going with you and me supporting you or helping you find somebody that you find that you're comfortable with, and going back to something Kourtney says, every therapist is not cookie cutter. We all learn different techniques and different strategies. Some people specialize in special tools that help with post-traumatic stress disorder. And a lot of times you find that in men, especially if they've been in the military or if they're police officers or they work with firefighters. I was talking to a friend of mine the other day who's a firefighter, just seeing all of the things that they see in the day-to-day life of, but they won't go. I said, do you go to treatment? And he's like, no, we got it offered to us, but we don't go. Why? Take advantage of it. That's a lot to see on a daily basis. So just normalizing it, being a friend, reducing the stigma, normalizing it as much as you can, and just say, dude, it's okay.
All right.
Read that final question.
Oh, the final question, I guess. Should someone interview a therapist to find one that can be comfortable with? How do you choose a therapist successfully? Successfully.
Yeah, I definitely think you need to interview your therapist, or at least look into them. Find out what their specialties are based on what you might think your needs are. Some people specialize in different things. Like I don't do EMDR, which is eye movement desensitization. I can't say that word. I don't do that. But if you were needing help with trauma or something like that, and that was something that you needed, I would have to refer you to somebody who does that. So you don't want somebody that's practicing outside their scope of practice. If you're not a child therapist, you don't want to see children under a certain age because the modalities that you use are different with children than they are with adults. So you want to find somebody that is licensed and professional. You want to find somebody that is culturally competent to deal with your issues. You want to look at how long they've maybe been practicing. Sometimes age matters to some people, not all people. How long they've been in practice. What modalities do they use? If they have their own therapists, get recommendations from friends or family. I would definitely look into that and ask questions. You want to ask questions about insurance, no insurance, all those different things, and why do they do what they do?
Right.
I don't have a problem with people asking me on their first session. I generally open the door after I've talked to them for a while. What questions do you have for me? A lot of times people don't ask me questions, but you are open to ask me, why did you choose this? Why do you do eating disorders? My eating disorder clients may ask me, but why do you do what you do? Why are you passionate about? You need to get a feel for that person. And then if the first person you see don't fit the bill for you, don't stop.
Okay.
Find somebody else. We're not cookie cutter. Everybody's not for everybody. So the first therapist you meet may not be the one for you. You may try 3 before you find the one that really, really connects with you. I think I tried like 3 before I found one person that I felt connected with me to the point where I could be vulnerable and disclose what I needed to disclose to them. So yeah, definitely do that.
I wanted to say this before we get off the live because we are up in our time. But if you can kind of just go into about the eating disorder just a little bit, because maybe somebody didn't know that they can get therapy for eating disorder or that it was available, because I had no idea.
I didn't know that either.
Absolutely. So what I do, from day to day, every day. I work for a Center for Eating Disorders as a licensed therapist. Currently, our caseload is pretty much adolescents, but there is therapy and treatment for eating disorders. So most times when you think about eating disorders, you see a 80-pound white female, and that's the idea and the image that society gives us about an eating disorder. But eating disorders are not just for white people. And a lot of times we do that to ourselves too. We try to act like certain conditions and certain issues are only cultural. Only white people get that. Black people don't get that. Black people can have an eating disorder. So you can have anorexia, you can have bulimia, you can have binge eating disorder. And my experience has been most African Americans a lot of times have more binge eating than anorexia disorder, which means we overeat. And sometimes it could be emotional eating that spirals into binge eating. But there are different levels of therapy for eating disorders as well. You can have an outpatient therapist that will see you and talk to you for eating disorders. Where I work, we are partial hospitalization. So the clients are with us for 10 to 12 hours a day for partial hospitalization until they step down to IOP, which is intensive outpatient. And they come a few hours a day until they're discharged back out. If it's very severe and we can't treat you at partial hospitalization, you may need to be hospitalized for an eating disorder. Anorexia will shut your organs down. It's the highest mortality rate of all mental health disorders is anorexia nervosa.
Wow, did not know that.
And people that may be overweight, and I know we talked about this before we came on, people that's overweight, they can also have an eating disorder, correct?
Absolutely. Generally, that would fall under the binge eating category, where people tend to eat a lot in secret. They overconsume food. I mean, you find people eating tubs of ice cream or packs of cookies, or they even eat astronomical amounts of food. When you think of my 600-pound life and things like that, that's a lot of hoard eating. That's not getting rid of that food like you find in bulimia. They eat lots of heavy volumes of food or quantities of food, but then they use diuretics or laxatives, or they purge to get rid of it because they don't want to gain weight.
Right.
Binge eaters aren't concerned about gaining weight. They don't care. So you find a lot of obesity and overweight people with binge eating disorder. And a lot of times it's really just hiding, masking emotions, things of that nature, not knowing how to deal with emotions, struggling with emotions. It may be adverse things in childhood. A lot of the clients that we see have adverse things happening in their childhood that spirals out of control, but it also can be connected to genetics. It's a lot of different things. And then the cultural thing with anorexics, as far as being thin, is a thing. We have in our society, Western civilization feels like you ain't right unless you really skinny, which is not the case. So and then you have body dysmorphia and body dissatisfaction and all those things that couple with eating disorders as well. So it's a lot.
Wow. Well, we thank you so much for joining us. It looks like that this people have really enjoyed this. Do you think that person? The question was asked. Do you think that those persons with 600-pound life suffer from some mental issues? I think so.
Co-occurring, yes. I think there's some underlying issues that probably should have been addressed long before they started binge eating to that magnitude.
Yeah. So again, thank you so much. And I mean, I know you can't see the chat like we can, but people are loving it. They are so grateful for Kourtney and Eddie putting this on to let them, just have a conversation, because it needs to be discussed. So I appreciate everybody that's in the chat. I thank you so much. I hope that people got some kind of nuggets from this, because it was a host of information. We can go a whole nother hour. I mean, I take up your time, and so I appreciate you for taking the time to come on.
I just want to say this: I learned a lot tonight. I really did, and I appreciate you coming on. Mental health is like you said, it's a sticky subject in our community, and the way you explained it and the way you dissected tonight was perfect. So we appreciate you coming. Really do.
I appreciate y'all having me. Anytime you need me to do anything, it's all about normalizing mental health for me so that people feel comfortable with getting the help. They don't have to be afraid. There are people that look like them, that speak like them, that act like them. You know, we just got degrees. It ain't about that. It's about God using us as tools to help people be delivered from all of the situations that may be plaguing them, keeping them from being their best selves. So that's what it's all about for us.
Thank you. So tell the people where they can find you. I'm going to put the information in here, but if you can just tell them where they can find you. And if somebody that's in this chat wanted to get your therapy, how can they reach you?
Yes, you can look us up on the web at willowgracewellness.com. That's our website. Myself and Tangi Macon, who is also a clinical social worker. willowgracewellness.com is our website. We have a Facebook page, which is Willow Grace Wellness, and on Instagram, it is Willow Grace Well. Our office is, if you're in Birmingham area, we're located in Vestavia, in Suites 101 and 103. Our address is 2028 Kentucky Avenue. It's right off the main strip, not too far from Steinmart. You can't miss us. We right over there. Okay. So God provided us a great safe space to bless people and be of service to the community. Our long-term goal is to have a full-fledged center, not just 2 offices, but a full-fledged center where we can actually facilitate groups. Which is something that I'm passionate about. And one of those things is co-parenting groups. I have a strong passion for co-parenting groups and teaching parents who are divorced or never married how to better co-parent their children so your children don't have adverse effects from you guys not agreeing on how to raise them or what they need growing up. So gotta find a place for groups.
Oh, wow. That is awesome. Do you have a phone number?
Right now I'm using my personal cell, and it's 205-240-6615. You can leave a message for me at that number and I will call you back. You can email me at valencia@willowgracewellness.com. All of that information is on our website. Tangi's number is also on our website. Again, we are growing so that some of the things, because of COVID, we weren't able to put everything in place out the gate, because we just didn't have the resources, but God has blessed us that we are, like I said, we now have up to 25 clients and our business is growing. And so we just started electronic medical records now. Wow. We don't have to handwrite them anymore. So he's creating provisions for us as we grow to develop and have more things in place for our clients.
Wow. Well, again, we appreciate you and thank you so much for your time. I'm going to put all that information. I may have to inbox you and ask you for some more information. I'm going to put it in there, and so that people can come back and they can get the information and be able to reach out to you. Because if I ever need a therapist, you probably going to be her, because you are just down to earth. Yes. And it sounds like I could just kind of relax, you know, and just talk, you know, because people just talk. I don't think they have to just put on airs. That's one place. You don't have to put on airs when you go to the therapist. Just talk. So
let me say something about that real quick. I went to a therapist over there in Vestavia, and he was kind of, I won't say intimidating, but I wasn't comfortable talking to him. I just couldn't be myself. Mm-hmm. And, I had to stop going after a couple of sessions, you know. So it's good to have somebody you can be comfortable and talk to and just get it out, and you know. So
yeah, most definitely. So and we wish you nothing but total success in all of your endeavors, and that Willow Grace will grow to well known to where, you know, it's international or whatever you want it to go, national.
I receive that. Hallelujah.
So hopefully we can get you back on here maybe in 6 months. So, you know, people, you know, we can talk about it again, because I don't think it's a stopping conversation. I think it's forever conversation.
I feel like we get back on, you know, like you said. Yeah. Just touch bases, you know what I'm saying? Yeah. And people can just, you know, get introduced to more and more audiences and whatnot.
Right.
And if you ever just want to do a segment just on eating disorders, we can do that too, because I don't think it gets talked about enough in our community.
Yeah. Somebody said I wish she was in Los Angeles, but you do tell a doctor.
Yeah, we do telehealth. I mean, we can set up telehealth and do it. It's not my passion to do telehealth. I like face-to-face counseling. I feel like there's something lost in the connection when we're doing it online. But we do offer it as a thing. It's just not my first preference, but it's available.
Okay. All right. Good to know. So on that note, you guys, I appreciate everybody that's in the chat. I appreciate Ms. Vidal for always moderating for us.
We do.
And I appreciate everybody that said a comment. I didn't put all of them on here, but definitely we appreciate.
Yeah, we appreciate that, y'all.
Yeah. Okay, I said maybe I need to go to so yeah, we'll definitely get you back on to do a session on eating disorder because somebody just said, yeah, that sounds great. Right. So yeah, definitely. Because we didn't know it was. I didn't know it was like, therapy. Yeah. So on that note, you guys, I appreciate you. Thank you so much. I appreciate you so much. And we status up in the chat because you being status up talking and
I love it.
Yes. Time over there. So we appreciate everybody. Is there final words you want to say?
No. I enjoyed the session. Can't wait to do it again, and we wish you nothing but luck.
Bless you. You guys too.
All right. Bye. Have a good one.